Hi, my name's Stu Fenton and I'm a psychotherapist and I specialise in ChemSex and working with clients who are presenting with ChemSex problems. I've worked in a number of facilities, therapeutic communities and hospital settings, but I've also worked in private practice, and the vast majority of my clients have been LGBT community, MSM, gay men having sex with other men, engaging with crystal meth and GHB while also utilising the dating apps. I also have a lived experience of engaging in chemsex myself and have been sober now for a number of years. The term chemsex was first used by David Stewart, who was a frontline healthcare worker in the UK. And his strict definition of this is that it's the combining of crystal meth, GHB or GBL with mephedrone with gay men or men having sex with men, and using apps such as Scruff and Grind to connect with one another. I think also part of the history with chemsex is that it began really in Los Angeles and New York in America way back in the early 1990s. And we know this because Crystal Meth Anonymous began in Los Angeles around 1995. And I think what happened was that with a lot of tourists going between Australia and the US, the drug crystal meth was eventually sort of found its way to Australia along with GHB, and men started partying with it there. And there was quite a lot of chemsex and use of crystal meth and GHB for sex going on in Australia. It was a lot later hitting in UK and Europe, and really started to get quite bad there around 2012. There are many reasons why gay men engage in chemsex, and a lot of these reasons sometimes can come from minority stress. Minority stress obviously includes things like workplace bullying, coming out of struggles of being in gay relationships, trans and bi phobia. Some LGBT people experience hate crimes, and also from abuse, just from society or from families, including rejection from family. And there are also a very different kind of reason why people will present, or when they're presenting with you saying that they're having problems with chemsex, which are different to those underlying issues which might be discovered with counselling. And those might include they do it for pleasure, or they do it to feel a sense of belonging to a group, to feel powerful, to counteract self-doubt, to give themselves a sense of identity, to avoid feeling old if they're getting older in the gay community, and to avoid feeling shame, or to give themselves a sense of status. Not everyone who engages in chemsex has a problem with chemsex. However, some people do. And some of the reasons that people will present to a counsellor or a psychotherapist will be that they're having problems with GHB or GBL and they're overdosing. Sometimes people end up committing suicide because they are not able to break free from their chemsex behavior. They're consistently having come downs from the drugs, or they're experiencing drug-induced psychosis as well. People who have already mental health issues like anxiety and depression, constantly using crystal meth and GHB and staying up for days on end, can exacerbate those mental health conditions. People's quality of life and their relationships with their friends and their families can be affected in a negative way through ongoing chemsex behavior. Another one of the negative impacts of chemsex is in regard to crimes. So with sexual assault, in these sexually charged environments, consent lines become blurred. Sometimes people will take advantage of people who have overdosed on GHB, or if they're psychosis and they're not really aware of what's happening in their surroundings. And also STI infections such as HIV and Hep C, as well as syphilis, gonorrhea, chlamydia. These are really negative impacts that happen when people choose not to use condoms, or that they're having sex with multiple partners in a short space of time. In regard to HIV rates for a number of years were increasing before PrEP started to be used on a regular basis. And one of the reasons I think that this was increasing for a period of time is that when people are out using drugs, for especially crystal meth, for a long period of time, 3 or 4 days at a time, they stopped being consistent with taking their medication at the same time each day. And then the last issue or negative impact is around psychosis. And not everyone experiences drug-induced psychosis, but there are a number of people that are susceptible to it. And if you're experiencing this on a regular basis, it can be quite detrimental to a person's sense of themselves and their own well-being. I just want to speak a little bit about drug-induced psychosis now, because quite a few chemsexes do experience this from time to time, but not everyone will experience drug-induced psychosis. Sometimes people mix up different ways people are presenting as being psychosis, but usually people who are using crystal meth will either be paranoid, and we all know what paranoia is, just thinking people are talking or about us. Or having thoughts about us. And then the next stage is delusions. And usually these can be auditory or visual. And with people engaging in chemsex, it's more often auditory, believing that you're hearing things or hearing messages come through the radio or the television or through the lyrics of songs, that sort of thing. Sometimes it's visual, believing that you're seeing things, especially for people that have been up for many days on end. And then the final stage is full-blown psychosis. And a lot of the time healthcare workers want to know what does full-blown psychosis look like, or what does it present as? And usually, in my own experience as a psychotherapist, it's if I'm talking to someone on the phone and there are long pauses before they answer me, or they're whispering, or sometimes they stop talking completely. I mean, these are really strong giveaways. The other thing is, some of the things that they might say is, I'm really worried about my safety, or I'm worried that my grandmother's in danger, or my mother's in danger, or I feel like I've done something really terrible, or the police are after me. These are always big giveaways for me that someone is in psychosis. And finally, just the three different types of psychosis that exist. The first one is where people believe there's bugs or germs under their skin, and this is the one where they pick at themselves and will end up at the end of a binge with cuts and wounds all over themselves. The other one is called delusions of persecution. This is where a person might think they're being followed or filmed, or that someone's out to get them, or someone's going to kill them. And this will come up in a counseling session if you're talking to them. And then the third one is where the person thinks that they're a religious figure, or Jesus or something like this. This is also dangerous because a person thinks they're invincible in this case, and they will often run in front of traffic believing they can't be killed, or they might jump off a building feeling like they might be able to fly, things like this. And quite a few gay men have died in this way. What are some of the things that people will say when they're presenting for help? Clients who are presenting for help with chemsex will often say things like, I'm having trouble in my relationship, or I'm having trouble with online apps. Or they might say, I have fears of getting HIV, or I've been getting STIs, or I recently got syphilis several times. They might say that they're struggling with isolation and feeling disconnected from the community or from family or friends. Or they might say, I know I'm addicted to this drug or that drug, and I want to do something about it. They might say that they're experiencing psychosis, or that they've overdosed several times on GHB and they're very worried that their life is at risk. Police may have become involved in their lives for some reason or other. These are some of the reasons people will present for help. I just want to give a couple of examples of cultural competence. So when we were running R12, which was the LGBT rehab in Thailand, we had to eliminate the use of the word slamming, because slamming is a very triggering word that we found out for most of the MSM that were coming there. And, sometimes if someone used the word slamming in a group, people would be triggered and have cravings and be quite disorientated from that. So we found eliminating was a really good course of action. And another example of this is that when I was at the ChemSex conference in Paris last November, I was sitting next to a woman at lunch who is a doctor and heterosexual, working at a clinic in Switzerland. And I asked her why she was at the conference, and she said she had just joined this clinic, but she knew nothing about ChemSex, but that they got a lot of ChemSex clients there, and she wanted to understand better how to work with these clients. And I think this is a good thing because some of the idiosyncrasies about the way gay men engage with chemsex will need to be discussed, and this means sexual behavior. And there's quite a lot of sexual terminology and behavior around chemsex that I think is important for frontline workers to know and understand and be comfortable talking about when they're sitting in the room with someone. What has been the LGBT community's responses to chemsex? Over the last 5 to 10 years, there has been an enormous response from the LGBT community to combating chemsex. So, initially, as I mentioned earlier, in 1995, the 12-step program Crystal Meth Anonymous was formed, and initially it just existed in Canada, the US, and Australia. It's now been running for almost 25 years, so a very long time, and also they have meetings now in Berlin, Holland, Iran, and New Zealand. Secondly, cultural competence is important. So, as I said also earlier, they are now running the European ChemSex conference, which is a massive conference held every year to educate frontline workers on everything about chemsex culture. It could be to do with the sexual behavior that they engage in, or it could be to do with the way drugs are administered, smoking or injecting or ingesting, as it were. And then also with building partnerships and pathways. And the easiest way to explain this is if you have a chemsex client who presents for their sex addiction, and then you're able to refer them to a 12-step program or a support group or to another therapist who does trauma work or does TRE or somatic experiences, and then you refer them to someone else who might be able to help them with EMDR or some other sort of therapy. Other ways the LGBT community has responded to the chemsex problem is by learning how to eliminate stigma and judgment, because a lot of people in the gay community trying to get help for this find that if they are judged or stigmatized for engaging in chemsex, they're less likely to try and get help. It's also really important for frontline workers to identify what is working with a particular client. Different clients respond to different approaches. So CBT may work really well for one client. A 12-step program might work well for another client, but also not for others. So it's really important to always be talking to other therapists and finding out what works for them and experimenting with new techniques and watching what works for a particular client. Another response that works really well is when therapists share their expertise with other therapists. And the European ChemSex convention that is happening now every year throughout Europe is a really good example of this. Different people from different countries are presenting their findings, their understandings, what works, and it's a great way to share information. Also, creating safe spaces is really important. One thing, as an example of this, is in Los Angeles. There's a 12-step Crystal Meth Anonymous meeting, which is called Leather Fetish and Kink. And a lot of the people attending this meeting will attend because they find that this is a safe place to be able to talk about chemsex specifically and the way they engage with sex. And it allows them to create not only a safety for themselves in what they're talking about, but to be able to accept their sexual behavior as good and to know that they and others can do it without having to use drugs. So in summary, this section was about defining exactly what chemsex is, and I think it's seen a little bit differently in different places. As I said, in the UK, they basically call chemsex the combination of crystal meth, GHB or GBL, with methadone and sexual behavior and the use of online dating apps. But I think more broadly in the rest of the world, the definition is not that strict. I think that chemsex, or what they call in American culture party and play, can be sex combined with any number of drugs as well as the use of online apps.